Okay, good evening, everybody. Please let's join. Okay, good evening, everybody. Please let's join. I'm waiting for people to join the meeting. Please let's try and join. If you're here, please write down your name so that I'll know who's here. Okay, we have 3 people that have joined. I need more numbers. 2 people have joined. Yusuf Ahmed is here. 2 people have joined. Yusuf Ahmed is here. I need more people to join. I won't start until I see reasonable number of people. I need more people to join. I won't start until I see reasonable number of Okay. We have um we only have 5 people based on my record here. We need more people, right, to join. I have a very busy schedule. I I'm creating time out of my busy schedule so to do this. So if the class is not that interested, I have things to do. Class rep, please tell people to join. If they are interested, they should join. The earlier the better. Okay, Ashiru is here. Welcome. Not that interested. I have things to do. Class rep, please tell people to join. If they are interested, they should join. The earlier the better. Okay, Ashiru is here. Welcome. Okay, I think we have reasonable number of people. I wouldn't waste time. So if you can hear me clearly, please write, we can hear you, sir. Let me be sure that you can hear me. If you can hear me, please type, we can hear you loud and clear. All right. If you can hear me, type, we can hear you loud and clear. Let's start. Yusuf Ahmed, if you can hear me, please write. Ashiru Haruna, if you can hear me, write. Abubakar Adam Umar, if you can hear me. Okay, Fatima Road, you can hear you, very good. Is she the only one that can hear me? Okay, Ashiru can hear me also, very good. All right. So you guys can hear me. So let's begin. Today we will cover cardiology and maybe pulmonology and some part. Let's see how far we can go before our time is up. Okay, so this question states that which of the following defines heart failure? Inability of the heart to pump blood. You know, in best of 5, all can be correct, but you are looking for the most correct. So which of the following defines heart failure? Inability of the heart to pump blood, inability of the heart to pump blood to meet the metabolic needs of the body, inability of the heart to pump enough blood to meet the metabolic needs of the body in the presence of adequate atrial filling, and none of the above. So please write down the answer if you know the answer. Which one is the most appropriate answer? Which one defines heart failure? If you know the answer, please type it in the live chat box, so that if you don't, I'm going to give you 1 minute, then I will go ahead and answer it so that we can speed up today. Okay, Mona wrote C. Okay, Abubakar Adamuma wrote C. Any other person? Any other person? Okay, so I should also wrote C. So the answer is C, right? So if you are defining heart failure, there has to be adequate atrial filling. If the atrium is not getting adequate blood, you cannot say that there is heart failure. Very good. So let's move to the next question. Okay, so we said which of the following is an example of low ejection fraction heart failure? This one is better for those who are doing cardiology now, but I will explain. When we say low ejection fraction heart failure, is the type of heart failure in which the amount of blood that the heart pumps out is not much. So which of these causes of heart failure do you think will affect the ejection fraction more? So we have anemic heart failure, hypertensive heart disease, beriberi, thyrotoxicosis. All these ones can cause heart failure, but some of these will cause high output heart failure, while the other ones will cause low ejection fraction heart failure. That means the blood coming out is not that much. So which one, if anybody has an idea, you answer. The second question in cardiology. Which one is the answer? Okay, class rep said is B. Okay, any other person? I'm going to give you some seconds, then I'll go ahead and answer. Okay, I should have said A. Okay, so this one, let me go ahead and answer. The low ejection fraction heart failure is hypertensive heart disease, while the anemic heart failure, the beriberi and thyrotoxicosis, all of them will cause high output. So the ejection fraction will rather be high, while in hypertensive heart disease, it is low ejection fraction. And other common causes of heart failure in this environment is peripartum cardiomyopathy. The cardiomyopathy that you see in women just before delivery and after delivery, ischemic heart disease from myocardial infarction, right? And also people with rheumatic valvular disease, people that have rheumatic fever. I know they must have started teaching you something like that in pathology. Okay, so the answer is B, is the one that will give you low ejection. Autopnea, tachycardia, S3 gallop, and rails. The question here is which of the following is not a major criteria? So in other words, you have to know the major and minor criteria. So after we answer this question, I will rattle some of the major and minor criteria. So anybody, do you know the answer to this? Because you cannot clerk and tell us that it's had major and minor criteria. Anybody? If not, I'll answer it. I'm giving you a few seconds. These are the things that have high possibility of being asked. You know, this, apart from things that you have been taught in your lectures, there are things that it is expected that they have taught you in while doing ward rounds, right? So it's expected they have taught you while you're doing ward rounds. Okay, so actually the answer is B, as written by Abubakar. So the major criteria include autopnea, PND. Pay attention, please. Autopnea, PND, raised JVP, S3 heart sound or S3 gallop. Rails is a sign of pulmonary edema, is also a major criteria. The minor criteria are the tachycardia, the pedal edema, hepatomegaly, ascites. All these are minor criteria. So for you to make diagnosis, you need two major criteria and one minor, or one major and two minor. Okay, this is very, very important. So from what I said, what is the answer for this one? The following are minor criteria except. So which one, if you have paid attention, you should answer this one. Which one of these is not a minor criteria? Okay, Abubakar, which one is not a minor criteria? You know, I just rattled the major and minor criteria, so it's expected that you people were paying attention. So which one of these is not a minor criteria? What will be your answer? Does anybody know the answer? Or I will go ahead and answer. Does anyone know the answer? Okay. Okay, Abubakar wrote D. Okay, very good. So you people paid attention. Okay, so REST JVP is, yeah, you're right. Mona, Mahmoud Musa, you're all right. So REST JVP is a major criteria. Very well. Okay, so let's move ahead. So pay attention. The following are X-ray findings in heart failure except. You know, it is expected that they taught you basic investigations in cardiology, and one of the investigations in cardiology is chest X-ray. So the question is, the following are X-ray findings in heart failure, chest X-ray finding, except cardiomegaly, pleural effusion, Baldwin sign, narrow mediastinum, Kelly line. So which one of these is not seen in heart failure when you do chest X-ray? So which one of these is not seen in heart failure when you do chest X-ray? You can go ahead and answer. Which one of these you don't expect? Okay, very well. Kabiru Yusuf said D. Any other person? Okay, Mahmoud also wrote D. Okay, I should also wrote D. So that's the answer. Narrow mediastinum is seen in people with COPD. So the answer, so all the other things you can see in heart failure. All right. Okay. So any questions so far? Hope nobody is left behind. If you are left behind, please speak up. I'm going to give 1 minute, no, some seconds for anybody that has question. Please ask or we keep going. Does anyone have any question? For other people, please note that you can only comment if you have subscribed to the channel. If you have not subscribed, it will be difficult for you to write comments. Okay. Okay, so let's go ahead. Since I have not seen any question, let's move ahead. So okay, so there are no questions, so let's go ahead. The question here is, the following are common causes of heart failure except hypertensive heart disease, ischemic heart disease, myocarditis. Okay, ischemic heart disease is repeated twice here, sorry. Pericardium cardiomyopathy. So which one is not a common cause of heart failure? These are simple things to help you just remember the common causes of heart failure. So if you know the answer, which of these doesn't look like a common cause of heart failure? Okay, very good, Mona. So C, myocarditis is not a common cause of heart failure, though it can lead to heart failure, but among the common causes of heart failure, it is not. Very good. So you guys are okay. So for some of you that have been seeing the treatment that is being done in the ward, you pay attention to this. The following drugs only improve symptoms in heart failure patient, but have no effect on mortality. So which of these drugs only improves symptoms but have no effect on mortality? Furosemide, digoxin, spironolactone, A and B, none of the above. So which of these three drugs only improve symptoms, but in terms of mortality, it has no effect? Okay, so write A. Okay, I saw Mona wrote A, Kabir Yusuf also wrote A, Yusuf Ahmed also wrote A. Okay, so this question is a bit catchy. All right, this question is a bit catchy, so you have to pay attention to get this answer. So actually the answer is D, because both furosemide and digoxin have no effect on mortality. It's spironolactone that improves both symptoms and mortality. So you see, D, it says A and B. So that is the appropriate answer. Yes, I agree that A has no effect on mortality, but same applies to B. So the answer would be A and B. All right, let's go. Okay, so another question, right, which you should get considering my earlier explanation. The following drugs affect both morbidity and mortality in heart failure patients: furosemide, spironolactone, dapagliflozin, C and D, none of the above. So how will you answer this number 18? How will you answer number 18? Okay, Mona said B. Okay, I'm seeing B. Okay, I'm seeing B. Okay. Is anybody in cardiology? South Caleb? Okay, you said B also. Okay, so very important. That's the use of this meeting. The answer is still D, because dapagliflozin, which is an SGLT2 inhibitor, has been found to also improve morbidity and mortality. So since spironolactone will improve morbidity and mortality, same as dapagliflozin, your answer will be C and D, right? The answer will be C and D. Those who are in cardiology, they are not representing much. Okay. So let's go. So, but if you have question, please ask while we are moving. So the following defines peripartum cardiomyopathy. What is the meaning of PPCM? So here, sorry for the typo. Here it says heart failure between the period of 10 weeks before delivery to 10 weeks after, 5 months before delivery to 6 months after, 5 weeks before delivery to 5 months after, 6 weeks before delivery to 6 months after, none of the above. So what is PPCM? You people usually see PPCM, right? Okay. So Mona said D. In the word, for those who are trying, following up with word rounds, you must have seen PPCM. So Mona said D. So Mona is right. The answer is D. 6 weeks before delivery and 6 weeks and 6 months after. Okay, so that's the answer. Let's move to the next one. Okay, so the next one is about the precipitation. Anytime they ask you to clock, right, you must also say if the patient is in heart failure by using the Framingham criteria, the major and the minor criteria. 2, you must say the cause of the heart failure. So you say, okay, congestive heart failure secondary to hypertensive heart disease. Then you must mention the precipitant. So the question here is, the following are precipitants to heart failure except chest infection, atrial fibrillation, graded exercise, anemia, none of the above. So which of these is not a precipitant to heart failure? If you go ahead and answer it and explain. So which of these is not a precipitant to heart failure? Okay, someone wrote answer. Mona said A. Okay. Any other person? Where is Yusuf Ahmed? I should attempt. Okay, Abubakar says C. Okay, so the answer is C actually, because even if you have heart failure, it's not that we want you to do exercise, but the cardiologist sometimes suggests graded exercise, just like going to toilet, like doing some minor things, not serious exercise. But chest infection, atrial fibrillation, anemia, they are all precipitants of heart failure. Okay, so let's go. So this question is on ECG. Which of the following defines sinus rhythm on ECG? If they give you ECG and they ask you what is sinus rhythm, what will it be? Here we say a regular RR interval. Is this sinus rhythm? P wave preceding QRS complex. Is this sinus rhythm? P wave preceding QRS complex with regular RR interval, or none of the above? Which one is the answer? What defines sinus rhythm if you do ECG? Okay, so yeah, the answer is C. You have to have P wave that is preceding QRS complex, and the RR interval must be regular. So if the RR interval is not regular, then you have to determine if it is atrial fibrillation. One thing that you should know about atrial fibrillation, which is very important, I don't know if I have asked about it, is that there is no discernible P wave in atrial fibrillation, and the RR interval is not regular. No discernible P wave, and the RR interval is not regular. So for this question, it said which of the following is correct? You need to know the axis. As 400 level student, you must know axis, you must know rhythm, you must know rate. So the question here is that which one is correct? Is AVF perpendicular to lead 2? AVL, is it perpendicular to lead 1? AVR, is it perpendicular to lead 2? AVR, is it perpendicular to lead 3, or none is correct? So which one is correct here? Which one is correct? When you determine the most equidistant or isoelectric lead, you need to know which one is perpendicular, which lead it is perpendicular to. So which of this is correct? Okay, I should have said D. Any other person? Any other attempt? Okay, I saw Ashuru's contribution. Any other person? I want people to participate. Please participate. The more you participate, the more you get the answers. Okay, So ECG, they will bring ECG for you. I don't know what they watch. So if you do not have an idea on ECG, it's going to be serious problem. So please, if you do not have an idea, tomorrow during what rounds or whatever your team is doing, please ask questions on ECG, because it's one of the basic examination or investigations that is done in cardiology. So actually you're right, the answer is D. For your knowledge, you should know that just follow it in alphabetical order. When you are counting your ABCs, you know there is F, you get F before L before R. So FLR, FLR, that's, then they are all perpendicular to, F is perpendicular to lead 1, L is perpendicular to lead 2, and R is perpendicular to lead 3. So FLR 1, 2, 3. Okay, so let's answer the next one. So we are through with cardiology. Do you have any question? We are through with cardiology, and you people are almost through with your posting. So we need to cover more grounds. So any question on cardiology? Does anybody have questions on cardiology, or do we go to other systems, or when we are free we'll try and cover? But for the meantime, the next would be respiratory system. Any question on cardiology? Abubakar, Ashuru, Yusuf, Mona, Patience, Kabir, Yusuf. Do you have any concerns in cardiology? If I don't see questions, I will assume there are no concerns. So since there are no questions, this is what we'll do. Please, do you want us to continue, or okay, my battery is even down, we cannot continue? We have to, hopefully if I'm free tomorrow or next, we'll continue with respiratory system. Okay, because my battery is already, my laptop battery is already down. So we'll continue with respiratory system either tomorrow or next. I'm going to communicate with your class rep how we are going to do it. Please read basic things about ECG. Read basic things about heart failure, because a lot of your answers concerning heart failure did not suffice. You will not miss these two. Okay, so I think we'll call it a day. Tomorrow or next we'll continue with respiratory system. Is very short, so we may combine it with another system. By God's grace, we'll try and cover everything before your exams, by God's grace. So at least now we have covered 2. We'll cover all the specialties by God's grace before your exams. Okay, so for those who did not start with us from the beginning, you can go to the channel and click live. You will see the video. I will save it there so that you can still go through it. Okay, so and I wish you good night. Take care of yourself. We'll see you tomorrow. Bye bye.